For me, the most important thing is, connecting with the patient and doing what I can to try to help them and give them the best advice and do what I can to help them in terms of helping them feel better, helping them to live longer, and that's really my number one focus. My name is Jarrod Betz. I am an interventional cardiologist here at Adena Regional Medical Center. I'm born and raised here in Ohio. I initially am from Cincinnati, and I spent most of my time there growing up. I went up to Massachusetts for part of my undergraduate training, and then back to Ohio and Cincinnati, where I did further training with, I got a master's in medical school there in Cincinnati. I did my training at Ohio State University, and I spent a large portion of the time towards the end of my general cardiology fellowship, in the cath lab, and then your final year in the interventional cardiology sub-fellowship is basically 100% dedicated to doing procedural care. Thankfully at Ohio State, we were able to do large volume of procedures, including corneal work as well as TAVRs, and so that was something that I was lucky enough to participate and really be the primary operator on. Essentially what interventional cardiology entails is it's a procedural discipline within the field of cardiology. Cardiology has actually a number of different fields, including imaging doctors and electrophysiology doctors who work on pacemakers and abnormal heart rhythms. Interventional cardiology is a field where you get to do procedures such as stents and balloon valvuloplasties, and you can do peripheral work, pulmonary embolism, valve replacement, different structural heart procedures. I think the thing that I would want to convey to people is that, my focus and our focus is to help people and to do what we can. I trained at, really high-level centers, and, it was important to me. I did really well at these centers, and I had opportunities at other places. The reason that I came down here was to help bring services to this community that aren't currently available. And so we've made it a point to have what's called a heart team meeting, where we'll involve a number of the different physicians, kind of go over the pros and cons of each different aspect, whether it be surgery or cath lab procedures or medical therapy only, and weigh the risks, the benefits, the pros and the cons of each of these different options, and then come up with what we ultimately think is the best solution for the patient.